Since 1994, St. Joseph's Hospital has hosted Chippewa Health Improvement Partnership, or CHIP, an award-winning team of advocates working to create a healthier community. And though their behind-the-scenes efforts often go unheralded, this team of representatives from schools, churches, businesses, medical facilities, governmental agencies, and the public at large has greatly enhanced the quality of life for the residents of Chippewa County. Our community is very fortunate to have the support of their local hospital and key agencies to keep this program so successful.
The mission of the Hospital Sisters is to truly care and serve the vulnerable and the poor. The partnership does so by identifying those needs, respecting the needs of others, and serving others, as inspired by our Franciscan tradition.
Chippewa Health Improvement Partnership is a collaborative community endeavor striving to meet the health needs of the residents of Chippewa County and to ultimately enhance their overall quality of life.
CHIP is composed of 6 action teams, each one representing identified needs in the community. The action teams of CHIP focus on the results of community needs assessments.
We dare not assume that we know what the needs of our community residents are. We use evidence-based strategies to establish the health priorities and goals of our residents, and then we determine the root causes of those identified areas of concern and facilitate preventative and educational activities directed at improving health and overall well-being.
One area the group focuses on is youth issues. After successful awareness campaigns to reduce underage drinking, this action team will now focus on service learning and volunteerism for teens, a strategy the team feels will be proactive in how it will affect choices teens make about drinking and other high-risk behaviors. Another action team was initially created to address the fact that Chippewa County had the highest rates of hospitalizations related to falls in the state of Wisconsin. The Falls Prevention and Safety Action Team developed an award-winning comprehensive education program for groups of all ages.
20% of the emergency medical calls are for people that have fallen, and it's the whole gamut. It's infants falling off, say, a changing table, to teenagers falling off of skateboards, people falling, going to get their mail, senior citizens tripping on cords in their homes. So this committee is trying to make an impact in reducing that. Several agencies are involved. I'm the fire chief and the EMS service director in Chippewa Falls, and working with St. Joe's Hospital and all the other agencies that deal with people's health issues. We collaborate together and try to send the same message out for educational purposes to reduce this.
Challenge Chippewa is an action team promoting lifelong fitness and well-being. Based on national and state data, as well as the results of their own community needs assessments, this team identified decreasing obesity and sedentary lifestyles as a primary area of focus.
The Centers for Disease Control has identified 6 big factors or evidence-based strategies known to address overweight and obesity in our nation. And so Challenge Chippewa has picked sugar-sweetened beverages as one of those big 6 initiatives. And we're trying to impact the consumption of sugar-sweetened beverages by our youth. We feel that starting in kids is easier than starting with adults. We work to prevent the bad habits rather than to try and change them once they've happened.
Access to affordable dental care was also identified as an immediate concern in Chippewa County. Brought to their attention by emergency room physicians caring for patients in extreme dental pain, CHIP learned thousands of community members were not receiving the oral health care that they needed. CHIP took on the challenge to increase access to dental care and was instrumental in the formation of the Chippewa County Dental Foundation, with the end result a new, state-of-the-art, federally qualified dental facility in Chippewa Falls.
At the age of 18, my wisdom teeth were impacted. I didn't have insurance at the time. If it wasn't for the Dental Foundation and them supplying the funding for my surgery, I wouldn't have been able to have my wisdom teeth pulled. And now today I actually am having better dental luck due to the foundation.
Another successful aspect of CHIP is the power of collaboration, a necessary component for grant and local funding opportunities. As a founding board member of the Open Door Clinic, a free health clinic now serving over 30 people in Chippewa Falls per week, CHIP's coordinator was the bridge between the clinic and the hospital, obtaining equipment and access to testing service for this endeavor.
The Open Door Clinic serves low-income people, people whose income is less than 200% of the federal poverty guideline, and who do not have other insurance or access to health care. We find that many of our patients come in knowing they have health problems, but they simply can't afford the medications they need to take care of themselves. Thanks to the Hospital Sisters grant, we are able to provide these medications to our patients at no charge.
Another CHIP initiative is the Chippewa County Jail Project. This action team has worked to enhance the quality of life of inmates and their families, while positively impacting the staff of the jail as well. By providing resources, information, and health programming, the team helps prepare inmates for successful transition back into the community.
The CHIPS program has really benefited the Chippewa County Jail and the inmates within the system as well as staff by the resource rack that's right there in the lobby right now that's provided. Also the visitor guide in the lobby for all the visitors that come in. They know the rules and regulations right away thanks to them. And the restock of the library with the games, the puzzles, which has all been a free resource by the community giving. And we appreciate CHIPS for doing that for us.
The work of CHIP has been recognized locally and statewide for its initiatives, and more importantly, CHIP's endeavors have led to significant changes in the community. Providing quality health care to all people, including the poor and marginalized, is in keeping with the spirit of the Hospital Sisters. It is because of CHIP's accomplishments that it has been recognized as a best practice with Hospital Sisters Health System.
Best practice, simply defined, is the most efficient and effective manner of achieving a desired result. Chippewa Health Improvement Partnership was identified as a best practice for 3 reasons. Number 1, it had to do with the overall awareness of community need, dating back to the 1990s. The partnership identified community needs assessment through various ways. They incorporated this through the value stream of the hospital and the colleagues. Number 2, if you look at the sources for data in compiling a community needs assessment, most organizations utilize one source. We've utilized a number of sources that include political advisory councils, volunteers, as well as identified approaches through surveys and interviews. And number 3, it's the steering committee that the partnership has put together. Through planning and dialogue, they're able to really translate what the needs are within the community.
Without the commitment and support of St. Joseph's Hospital leaders and the action of community partners, this could not be possible. It is the generous donation of time and services from volunteers and the financial and in-kind support from individuals, foundations, organizations, and St. Joseph's Hospital that make this program the success that it is.
CHIP is important to our community because if we are going to have sustained health improvements for our county, it's going to take the resources and talents and minds and time of many individuals working together. No one person or no one organization can improve the health of our community. We all have to work together.
Become a part of this dynamic team of hospital and community. The unique and varied talents of members and volunteers make Chippewa Health Improvement Partnership truly a vision of the future.